Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Galantamine. Its brand name is Razadyne. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Galantamine. We'll then touch on an example of dosing and finish it off with side effects with percentages. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So galantamine is a reversible, competitive acetylcholinesterase inhibitor with an unknown mechanism of action. However, it is suggested that the drug improves cholinergic function by increasing acetylcholine levels. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see it prescribed in the treatment of Alzheimer's disease in patients who are experiencing mild to moderate dementia. With respect to contraindications or reasons we would not be able to prescribe galantamine, well, we just wouldn't give this medication to a patient who had a hypersensitivity to galantamine or any other component of the formulation. Now for an example of dosing with galantamine, so in the treatment of Alzheimer's disease, and again in a patient who is experiencing mild to moderate dementia, using the immediate release tablets, we may see an initial dose of 4 milligrams twice daily, given for at least 4 weeks, then 8 milligrams twice daily. Some patients may further increase to 12 milligrams twice daily after another 4 weeks at 8 milligrams twice daily. For the extended release capsules, we may see an initial dose of 8 milligrams orally once daily this time, for at least 4 weeks again, and then an increase to 16 milligrams once daily. The maximum dose for the extended release capsules would be 24 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using galantamine, so we'll go over some of those here now. 7.5% of patients may experience a decrease in appetite, while again 7.5% may experience diarrhea. Nausea seems to happen in 21% of patients, and vomiting in 10.5% of patients. 7.5% may experience dizziness, and 7% may experience a headache. More serious side effects may include atrioventricular block, happening less than 1% of the time, bradyarrhythmia, happening 1% of the time, and 1.5% of patients may experience syncope or fainting. A seizure or a peptic ulcer are also possibilities. Alright everybody, that's all we're going to talk about today with galantamine or Razadyne. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.